Welcome to Ideagen TV, presented globally by Microsoft. Today, we are thrilled to have with us BJ Moore, CIO and EVP of Real Estate Strategy and Operations at Providence. BJ, welcome.
Thanks, George. Pleasure to be here. Always like to share our story here at Providence with Ideagen.
Well, BJ, it's what can you say? We're a few years into this decade-long march toward achieving the global goals of the United Nations, and appears we are emerging from this pandemic. You're very familiar with the pandemic in terms of having had the first patient in the United States with COVID at Providence. And there's been a lot of innovation. I mean, you're an innovation guy. There's been a lot of innovation that has resulted, that's been sort of the positive element that's emanated from the pandemic.
Absolutely.
A lot of these innovations have come from Providence and your leadership with Dr. Rod Hochman and the whole incredible team there. What are some of the innovations that Providence has incorporated into your health systems and operations to provide necessary care for patients across the board?
Sure. Well, COVID made us do a number of things. One is remote work for a lot of our employees or caregivers. Right, we're a 150-year plus organization, and we were very much always in the office, always face to face. And so, building collaborative, remote, work environments was, something we had to do early on in the pandemic. Another area of innovation early on was our remote care delivery, both telehealth as well as taking care of COVID patients at home. We went from about 10 telehealth visits a day to 10,000 a day. And we went from really not taking care of patients at home to taking care of 20 to 30,000 COVID patients at home. That was a quick way to really improve or increase the access that our patients had, increase our capacity during the pandemic, which was absolutely critical. And then things that we accelerated were anything predictive, right? Predictive analytics. How do we use big data, artificial intelligence, and machine learning to have predictive analytics around PPE, which early on in the pandemic was super short. How do we look at the surges of COVID and anticipate what communities we're going to see surges, maybe where we were going to see pullbacks in the communities. That way we can move our precious resources around. So predictive analytics and using tools like artificial intelligence and machine learning became absolutely critical.
And, as you describe these innovations, it's really awe-inspiring to hear really the continuum, the breadth and depth of what you've accomplished in the face of these headwinds. I mean, let's face it, this was probably and most likely one of the most difficult moments in human history for all of us. And yet, and despite that, Providence, your team, everyone at Providence leaned in to create these efficiencies and these opportunities for these patients across your spectrum to be able to get better quality delivery of healthcare.
Yep, absolutely.
And so do you, BJ, see these as lasting innovations that Providence will continue and take them to the next level?
Yeah, absolutely. Not only are they lasting, they're going to be accelerating. These are things that we had talked about before COVID, but there was no impetus. Take telehealth. We weren't being paid for telehealth visits. The culture of our patients, I'll use me as an example. Before COVID, the thought of doing a virtual doctor appointment versus being there in person was just foreign. And so these are things we talked about, and COVID really the pandemic really allowed us to accelerate the use of these tools, but more importantly, change the community and really seeing these as not only effective alternatives, but in many scenarios, better alternatives than the way we used to deliver care before. So these are absolutely not only lasting, but really our future of care delivery. A hospital will always be critical, but these remote care, telehealth, are managing your health from home, sending you home to be in a safe environment, but still giving you effective healthcare treatment. Is not only critical during the pandemic, but we're doubling down and we'll continue to focus on that going forward.
That's incredible. And I'd like to shift gears a bit. We saw recently with the International Women's Day 2022, Dr. Rod Hochman and a lot of you at Providence posted about the history, that
Yep.
incredible history of the nuns that actually started Providence. And it started with literally empowered women, in this case, nuns, that started this incredible organization. And I'd like to ask you, beyond that, what distinctive quality of Providence do you believe separates Providence and your work at Providence from other healthcare providers?
Sure.
And why is that a strength, BJ?
I think one is our scale. We're one of the largest health systems, and so things that you can only do at scale, the access to capital, the access to talent sets us apart. The diversity of the communities that we serve, we're serving rural communities in Alaska, and we're serving large cities, in Southern California and Seattle, and we serve communities in between. And so we have a good diversity of the way we need to deliver care and a great diversity of patients. And then the focus that we have on digital transformation, and that's really what brought me from Microsoft to Providence, is recognizing we need to change the way we deliver healthcare, and that digital transformation is part of that. And I'll have to say, what I found, with the board of directors and the executive management team are very supportive. So I think what sets us apart is our scale, our diversity of patients, environments we work in, and then this zest for digital transformation and really being at the forefront of that innovation.
Well, what's truly remarkable is that I recall that pre-pandemic, you were really interested in helping, obviously, to lead that way, that digital transformation piece. And here we are a few years later, and my gosh, you mentioned telehealth, one of my favorite sort of deliverables, if you may, that you've had led on here. You've led on this, and my gosh, I mean, what an opportunity to transform the way people expect to gain their care, to see their doctor on their phone, to get diagnoses, and on and on. And so many of those patients, but for that technology and that transformation that you were working on even before the pandemic, what an opportunity now for them to actually have continued their care when so many were not able to get that care because their delivery of healthcare wasn't available due to the lack of investment in these areas. So how, if at all, has COVID-19 shifted the way Providence specifically has interacted with communities in how you've offered their services? I know digital is a big piece of that, right?
Yeah, I mean, it's all digital. Before the pandemic, 99.9% of all the patient engagements were in person, in one of our clinics or in our acute care settings in the hospital. And really that digital engagement is really come in. It's chatbots, that we used early on in the pandemic to help self-diagnose if you should, stay home, you're safe, see a primary care provider, go to an emergency room. So that, was a way to digitally engage. We've already talked about telehealth, doing a telehealth consult, care delivery at home. So really digital is a new tool in our toolbox that really extends our breadth, extends our community's access to healthcare. And frankly, it's just more, it's a better experience for patients, right? I mean, you don't have to drive the 30 minutes in for your meeting with the doctor, wait in a waiting room, meet with the doctor, then drive back. If you're an hourly worker taking off time from work, that's just not possible. So these digital things not only improve our breadth of services, but allow us to get access to patients that maybe didn't have the time to get the proper health care. And so it's been a win-win on both sides.
Yeah. And so during COVID, there were a lot of hurdles for patients, right? I mentioned cancer patients. There are others. So many different maladies that people suffer from. What was one of the largest hurdles that you saw as an impediment to patients receiving access to care? And how are you working to solve this?
Yeah, the biggest has really come down to staffing. If you remember at the beginning of the pandemic, we talked about flattening the curve, and that was because we're all going to get the virus one way or the other, but how do we get it over a period of time to spread it over so our health system wasn't overwhelmed? And that really boiled down to our staffing. And what we see 2 years later is burnout, people that are leaving the industry, people that are leaving for other health systems. And so staffing has probably been the single biggest impediment of meeting the needs of our communities during COVID. And it's going to be the biggest impediment, now that the pandemic is ending. And so, what are we doing to retain that talent, keep them from being burned out? What are we doing to build a new pipeline of talent to attract them? In tech, we see as a real enabler there. If you're a nurse, only 40% of your time is actually spent caring for patients, and the other 60% is the administrative burden that we place on them. Through technology, things like ambient artificial intelligence, these devices that can listen to a conversation intelligently, record it in an electronic health record, can take that administrative burden off of our staff and allow them to focus on the care of patients. And that's why they got in this. So it reduces burnout, makes them more productive, allows them to deliver better patient care. And we think tech is a great enabler to do that. Right? Nobody enjoys doing paperwork. Nobody enjoys, filling out an electronic health record. So if we can replace that with some automated digital solution, that's a win-win for both the patients and the caregiver.
Well, there's absolutely no doubt that you are the right person to be leading this effort, having come over from Microsoft in your previous career for so many years there, understanding what digital transformation means, and then using your own personal experience in terms of having to drive to a doctor's appointment, et cetera, and understanding what kinds of technologies can actually help take the place and create these efficiencies, which is really what this is all about.
Exactly.
And perhaps even better diagnoses, because maybe you didn't miss your appointment because of the convenience.
Yeah.
What the pandemic did. So we had undeniable health effects on millions of Americans. They couldn't go to their doctor. If they were part of the Providence system, they had telehealth opportunities. So that was less of an issue. For some other systems, perhaps there wasn't the telehealth component. But this physical effect is undeniable. And how do you see the mental health piece becoming a priority as well?
Yeah, it's one thing I worry, the media and others became so focused on COVID, which is obviously a tragic component of the pandemic, but it's just one component, right? How do we step back and look at the overall health of a population and mental health being, a good example of that? It's not just how do you protect yourself from COVID, how do you protect yourself from other diseases, get care for cancer, get, mental health care. And not to overplay the telehealth card, but if you live in a small community, you may not have access to mental health care at all. And that's where these digital solutions really can reach communities, reach individuals that we couldn't reach other ways. And mental health is a good example, right? A telehealth consult with a psychologist or psychiatrist, where you may not have any in your community, have access to individuals to provide that care, to get that mental health benefit. Just as one other great example of how digital transformation of healthcare is going to improve that access. And your earlier point, the sooner you intervene, the less acute an individual is going to get, right? You can actually take care of them before it becomes a crisis. And so you're improving the health of that individual and therefore the health of our communities.
BJ, that is profound. And I'd like to shift a bit because your title, you have a very long title, which is
I do.
Which is synonymous with someone who has achieved a lot. And someone told me a while back, to those who much is given, much is expected. So I understand there's a lot expected of you in your role in the purview, which also includes your role as the EVP of real estate strategy and operations, right? So you're CIO and EVP of real estate strategy and operations. So can we talk a little bit about the real estate? Because I think this is a hidden area within healthcare that I believe you are also making a massive dent in the universe with. And you're punching a hole in the universe. by all of the efforts you're making with decarbonization and all that. But I'd love to hear from you, for our global audience, what it is that you're leading on there with respect to the real estate component.
Sure. Well, first, most people ask, why would a CIO own real estate, especially for a health system? And so let me answer that first. We really see physical property and digital properties merging. So it made sense to have that under one leader, like myself. Take a hospital room. Before COVID, we considered a hospital room a physical asset. We had a finite set of hospital rooms. And then once they were filled up, we couldn't deliver care beyond that within a community. During COVID, it became obvious that a hospital room could become more abstract, more virtual. That could be healthcare at home, it could be a telehealth consult, or it could be in the bed. And so allowing me to wear both hats to kind of virtualize our space, when do we physically use space? When do we virtually use space? And how do we integrate that is key. And then you talked about, you alluded to, we've got this big, bold goal of being carbon negative by 2030. And we're only going to do that by changing the way healthcare is delivered, changing the way our workforce interacts, creating these virtual, workforce where you can work from home, work remote, but still get your job done. That reduces your carbon footprint, reduces the amount of office space that we need. Telehealth could be delivered, from a doctor's home versus a doctor's office. And so we can more efficiently use our physical assets in space. Not saying that we would do this, but, challenge could be, how do we not build another hospital, but through efficiency and these other, digital innovations, actually serve a broader community, serve the growth of a community, but without investing in new infrastructure. And so that's the challenge I have. And that's why I'm both the Chief Information Officer in charge of that digital transformation, but I'm also responsible for the real estate component, because how do we make the intelligent trade-off between those two critical roles?
Well, and it's just it's something that is top of mind as I look at your title. It's just an incredible combination, and one that we've got to credit Dr. Rod Hochman
Absolutely.
with having that innovative vision to say exactly what you said is, here's an opportunity to create this innovation and efficiency, which heretofore would be very difficult to combine in various roles. So combining this role for you to lead makes us all feel like it's incredibly possible that there will be an incredible level of success in what you're trying to accomplish. So that is incredible. And you did mention at one point that, hospitals specifically generate a lot of carbon, right? I mean, that's part of the infrastructure, which I think a lot of folks globally don't really appreciate to the level that you've described here. So it's incredible to see that. BJ, we've talked a lot about the innovation. We've talked a lot about sort of the transformation. I'd like to talk to you about one other element that's near and dear to my heart, as you know, and Ideagen, which is partnerships. Yep. And we believe at Ideagen that partnerships are the key to solving many of the world's most vexing issues, especially when you look at cross-sector. You are the embodiment of that. You came from the tech sector, as you mentioned, into health, into this health arena that was begging for digital transformation. And here you are. Yeah. And I'd like to ask you, what kind of partnerships and or collaborations do you believe can foster innovation and further the work that you're doing at Providence?
Yeah, I think partnership is going to be critical. Obviously, I respect the executive management team and the talent we have within a health system, but the way we're really going to have these breakthrough technology innovations is through partnerships. That's partnerships with other big tech companies like Microsoft. And we've got a big strategic partnership there. It's partnering with large organizations that are developing digital health solutions like Nuance. I mentioned earlier the ambient artificial intelligence. We were partnering with them closely to develop that technology before they were acquired by Microsoft. And then, we create these consortiums. Truveta is a great example where, 20 health systems came together here in the US to create this data consortium called Truveta. And that's actually where Truveta hired the best talent from technology, from Microsoft, Amazon, Google, to create this innovative data company in Truveta, but it's owned and managed and directed by the health system. So we kind of get the best of both worlds. We're the stewards of our patient data, wearing our health system hat, but getting access to the tech talent, that comes out of these tech companies, I think is a way we're going to have these outsized innovation. Because the future of innovation is going to be anything in the cloud, anything big data, Internet of Things related, applying advanced technologies like machine learning and artificial intelligence. And let's face it, healthcare is not on the bleeding edge of those things. So how do we partner with other companies that are on the bleeding edge to take our clinical expertise, take our patient data, obviously with consent, to partner with these, technology companies to have these outside innovations, because nobody in the US thinks healthcare is perfect and it shouldn't improve. And I believe, and that's why I joined Providence, that digital transformation can be that biggest force multiplier to change the way we deliver health here in the US.
Amen. And absolutely, 100%. That's so true. And so shifting just a bit to something that we have talked a lot about it at Ideagen, and you talk a lot about it at Providence as well, which is inequalities.
Yep.
And so COVID, if anything was exposed during COVID, it was the inequalities across the spectrum.
Yep.
And time again, Providence is leading on helping to plug those gaps and inequalities and to highlight those inequalities so that something can be done about those. And so generally, how, BJ, do we eliminate these inequalities, especially in healthcare, for the future, utilizing all of the work that you're doing, especially with digital innovation?
And that's the irony, is digital innovation is going to both improve, equality. So if you're a primary care provider, of your children, or you're an hourly worker and can't get time off, things like telehealth give you access to care from home, which is fantastic, right? So that actually improves the equality of healthcare delivery. My fear is, though, creating a digital divide, that if you don't have a good device at home that allows you to do a telehealth consult, you don't have Wi-Fi or data access to have good video voice to consult with your doctor, the risk is that same digital transformation that improves the access to healthcare can also create a digital divide. So we're very cognizant of, how do we not allow this evolution of technology to create a digital divide? Instead, how do we use it as a catalyst to improve the equality and efficiency of healthcare? We don't have the solutions yet, but we recognize digital transformation can be both a benefit or it can create a digital divide. And we're very cognizant that we need to make sure that digital divide does not happen.
Yeah, and that's a good point, because we're familiar with your work with Microsoft, and Microsoft is really also very much focused on helping to make sure that doesn't happen, right? Or that it's addressed as we're going through this digital transformation. So that's another key area to be talking about, which is access to, broadband, for example, in rural communities, and on, which, if you take the heat maps of inequalities on any level, health, finance, etc.
Yep.
We know where these areas are. And if we can focus all of our efforts from a corporate, NGO, public sector standpoint, as Providence is helping to marshal, then we can drive that innovation and the impact and help those that need this critical care the most.
Yep.
And so, last question, BJ, we are at the point where you're leading, you're changing the world, you're specifically changing healthcare and the delivery of healthcare.
Yep.
How do you help to make this the best possible experience, the most fulfilling experience for patients?
Yeah, I mean, it's shifting the focus from being just episodic. You get super sick and you go to an emergency room or you go to the hospital. How do we shift that focus from being episodic to being more population health, right? How do you have devices, your Apple smartwatch that's monitoring your health, and putting that telemetry in the cloud where we can have a health bot that's monitoring your health more real time, so that you can have interventions earlier. Go to a primary care doctor, get your medicine or prescriptions adjusted. So how do we move away from this episodic? You come into the emergency room, and we obviously want to deliver fantastic care, and we'll always do that. But how do we then manage your health more holistically, more of the population health? And that's only going to be done through technology, right? We don't have enough nurses and doctors in the world to follow you around, George, and monitor your health. It's going to be technology that can monitor your health. And then we bring in the nurses and doctors at the right time to intervene or course correct or provide the care that you need. And so that's really the focus needs to shift to the end-to-end experience of a patient, the end-to-end health of the patient, and move away from being just episodic to more the health of a population or community. And obviously I have a bias because I'm a tech guy, but I think all your listeners will agree that can only be done at scale with technology.
And I do have a follow-up to that because it's very interesting. Are you seeing a greater level of adoption, both during and now coming out post-pandemic, where folks are more willing to embrace the technology? Have you seen that as an impact, as an effect?
Yeah, absolutely. Because they didn't have a choice, right? We were locked down in our homes. It didn't matter what you thought of telehealth. If telehealth was your only means of getting care, you're going to do it. If monitoring your own, I didn't even, have a oxygen sensor at home, before COVID, but I had one and started monitoring that. So absolutely, I think it changed people's behavior, and it changed it in a way that's permanent. There's more work to be done, but if there was a benefit of the pandemic, it did accelerate a lot of these change curves. And I think most people aren't willing to go back to the way things were before the pandemic. They see these digital tools as kind of permanent fixtures that actually improve the way they receive healthcare.
Well, I'll tell you, for the millions of people that will see this interview across the planet, I've got to tell you, I feel so good knowing that someone like you, BJ, is helping to lead the way to change the world, specifically the delivery of healthcare, because what you're doing will impact people and is impacting people without a doubt across the planet. You're leading, you're developing the models, you're helping to change the world in profound ways. And I think that if there's a silver lining in what the world has gone through, it's that we're entering this age of digital transformation in healthcare, and there's no one better to help lead it than you.
Awesome.
BJ Moore, Providence, changing the world. How can we find out more about Providence? Where do we go?
We're all over the media. You can go to providence.org, to our website where you see it. Connect with me on LinkedIn and forums like this, George. I really appreciate Ideagen giving myself and Providence the forum to share the great work we're doing for our community. So I really appreciate it.
BJ Moore, I'll recite your title again because I love it. You've earned it. BJ Moore, CIO and EVP of Real Estate Strategy and Operations at Providence. Thank you for all you're doing. Thank you for leading. And thank you, most importantly, for helping to change the world.
Awesome.
Ideagen Global, presented globally by Microsoft.